Senator Scott.
Thank you, Mr. Chairman, and I will certainly respect your time limits. I think we all should do that. And frankly, as we were asking Dr. Fauci for an estimate of how many lives may be lost, I recall the first estimates were between 1 and 2.4 million lives. So I'm certainly glad that we are not there. And perhaps one of the reasons why we should be thankful for where we are now and force ourselves to have a serious conversation about continuing to flatten the curve is because the all hands on deck approach is effective. We just need as much cooperation from as many people as conceivably possible in every state around the country in order for us to see these numbers continue to make a dive in the right direction as opposed to spike in the wrong direction. And I think about the Operations Warp Speed along with the crucial support from BARDA and other federal agencies, public-private partnerships, and accelerating groundbreaking technologies that could eradicate COVID-19 and revolutionize, frankly, the vaccine development landscape. Because of these efforts by industry, academia, and government working in concert, we could see a viable candidate or candidates in a matter of months for a vaccine. And because of a growing number of large-scale manufacturing agreements with companies like Moderna, Pfizer, and J&J producing hundreds of millions of doses at risk, which means in advance, we are already working to address issues of access, and this is critical, especially for our most distressed communities. That said, effective development and widespread access, while essential, are only part of the equation. If and when, and I feel optimistic that it's when and not if, we get a viable vaccine, we need to encourage folks to choose to get vaccinated. I was really concerned when I saw a recent AP survey that showed that only 49% of American adults plan to get vaccinated once the COVID-19 vaccine came to market. A full 20% said that they did not plan to get vaccinated, and 1/3 of Americans were not sure. Given the public's recent and vital focus on health disparities, it's worth noting that among certain groups, these figures are even more alarming. Just 25% of Black Americans, 37% of Hispanic Americans plan to get vaccinated against the coronavirus. My question to the full panel, what steps can we take at every level of government and in the private sector with healthcare providers to ensure a proactive education campaign and outreach strategy on the importance of getting vaccinated, both for COVID-19 and frankly, even more broadly?
I'll take a shot at it first, Senator. As I mentioned in response to another question, that we have a community engagement program that actually operates out of Operation Warp Speed, the vaccine development program component of that. Also, there needs to be engagement of people who the community trusts, particularly individuals who are noted sports figures or whomever. When we were involved and continue to be involved in community engagement with HIV, we used people in the community, boots on the ground, to go out who looked and lived and are like the people they're trying to engage. It's very critical because I share with you the concern that we get to the hoop and we get through it of getting a safe and effective vaccine only to find that a substantial proportion of the population do not want to get vaccinated. Of particular concern is it's that proportion of the population that generally are the most vulnerable in the sense of the minority communities, African Americans, Latinx, Native Americans, who in fact, because of underlying conditions, make it more likely that if they do get infected, they would have a poor outcome. So it's extremely important to engage them at the local level. Thank you.
Well, thank you very much for your answer, Dr. Fauci. Let me just close with my 40 seconds that I have left, respecting the time, and I hope that we continue to do so. But the pandemic has triggered a drop of 60 to 80% of immunization rates among children. And even now that states are reopening, we're not seeing the rebound in these rates that are necessary. This creates a real risk of secondary infections and disease outbreaks that are not on the general public's radar as we reckon with the chief crisis at hand. So I think it's incredibly important that we follow your strategy, Dr. Fauci, as it relates to engaging community leaders and perhaps people with notoriety to challenge us to get involved in taking the vaccines. Thank you, Mr. Chairman. I apologize for being 4 seconds over my time.
Thank you, Senator Scott, for respecting the time